The Cabinet Secretary in charge of health, that is Cecily Kariuki, is currently addressing stakeholders at Safari Park Hotel. Let's briefly listen in on the latest from that end.
Kenya Medical Dentist Practitioners Board and Medical Practitioners and Dentists Board. And the costs were amazingly very high. And we asked ourselves how many Kenyans would afford. This was prompted by a case where there was a petition by COFEC, where a patient was admitted in MP Shah Hospital and passed on within it was less than 12 hours. And the cost was at over 900,000. Of course, there was public outcry, and the hospital later waived the total and the entire bill. When we came to do the investigation as a committee on how this happened, they said they were following the guidelines, and we were interested to find the guidelines that has already been signed and given to the doctors as their fee. And we noticed that there were 2 surgeries that were done, and each one of them, I think the cost was almost half of that bill. And of course, the other cost, there's a theater, there are other, the pharmaceutical cost and non-farms. There was a total cost coming to 900 and something thousand. And so when we compared what was there in 2006, which was not gazetted, and I accept, I would just like to give an example of cost of, and allow me to do so again, of circumcision then, which was costed between 5,000 as minimum and 10,000 as maximum. But when you look at these new guidelines, because I have it here with me, it is important I read what is there because I know I can be challenged. The cost was coming up to between, for an adult, 18,000 to 50,000, and for a pediatric circumcision between 18,000 and 70,000. If you look at a normal incision and drainage, the cost then in 2006 was 5,000 to 10,000. Similar amount, but now the cost is 25,000 to around 60,000. And we asked ourselves, and we even asked the doctors, I'm advantaged because I have many doctors in my committee, how many Kenyans would afford that? Almost no one, even the ones with the insurances, there's a limit. And so we say there's need to review. And we mandated the board to go and review. And for us, we had a comfort, we discussed with the doctors within the committee, we asked ourselves, the costs that were there, we looked at several of them at 2006. Are they reasonable costs? And they said yes. And if somebody feels that the costs are not reasonable, then we are expecting to find the communication to Parliament. We have given a direction. There's an implementation committee that will follow up. But if there is any consultation that is needed or further, guidelines that will be given, we expect the board to come up quickly, not to defend the cost, because we all agreed it is not affordable. And when we are talking about UHC, we must talk about affordability. Yes, it is about affordability of doctors' fee. Even the hospitals will be going there. Even the cost of drugs in Kenya will be going there. But for now, we are starting from somewhere. A journey of 1,000 miles starts with one step, and that is our step 1. And so we are kindly asking our doctors, as they review the charges that are currently here, because they are not affordable, let us also the board call all the stakeholders, the consumers, there are consumer bodies that are available in this country, let them go to the hospitals, and we need to renegotiate. And we are hoping the board within the next 1 month, they can be able to give us a conclusive, a final reviewed cost on what should be charged to our patients. But currently, we cannot bury our hands in the sand. We cannot assume that what is here is affordable. We cannot lie to Kenyans. We have a responsibility, and that's why we have been given to oversight the ministry. And as we help the government to achieve UHC, we talk about NHIF, and even the costings that are there. A lot of our money in NHIF is going to the private sector. Why? We were here, and I'm happy today that the Council of Governors, they said we have 2 deputy governors who are here where they are piloting the UHC, and we have all agreed the issue of human resource, the issue of making sure that our public health facilities are working, so that we also even allow our people to be able to access to good services in our public facilities. But for that to be achieved, we must all work together. That is why today's meeting, we had the ministry, we had the agencies, we had NHIF, we had the board, we also had the KEMSA. We also had the county and we also had the Senate. We are saying we don't want to compete on who is controlling what resources, but we want to compete on giving the best services to Kenyans. And that is our prayer. And I hope it is going to be understood. I hope nobody will feel like we are trying to, bring them down. No, we are not at war with anyone. We are there for Kenyans, and we need to serve Kenyans. And we need to be truthful to ourselves. Yes.
Any questions from my colleagues? No? Yes.
That is the latest coming out from that press conference by the chair of the Health Committee in Parliament,